Hi everybody, this is Alice here, and this is gonna be my periodontal assessment project. This beautiful lady right here is my patient, Maria Hernandez. She is 65 years old. She is white and she is Latina. This patient has hyperthyroidism and gets together with her relatives every week to eat and drink. She recently got through a divorce and had been drinking more than usual. Now she's seeking treatment for alcohol abuse. She's attending meeting and taking medication as well. The patient currently is taking two medications. She is taking propylthiouracil for hyperthyroidism and acamprosate for alcohol abuse. The special considerations when taking these medications are the increased likelihood of comorbidities and declined organ function in the elderly, acute renal failure, and also may impair ability to operate heavy machinery or to drive. The contraindications are hypersensitivity to the drugs or their components and severe renal impairment. Oral effects are poor wound healing, oral ulcers and infections, and xerostomia. This is the periodontal assessment chart for the patient. As you can see, she has generalized recession throughout the mouth. Um, she also has a lot of 5, 6, and 7s pocket depths, especially on the posteriors and some on the anteriors as well, and bleeding upon probing. So this is the periodontal chart of the patient. She has generalized recession of the gums, and she has a couple of 6, 7, and 8 millimeter pockets throughout the mouth. She also presents with furcation involvement on all first molars. She has all these missing teeth due to periodontitis, and she also presented with bleeding upon probing. This patient is classified as generalized stage 4 periodontitis because she has a greater than 5 millimeter pockets. The bone loss is extending to the middle 1/3 of the root, and she had 5 or more teeth lost due to periodontitis. And it's generalized because this condition involves more than 30% of her mouth. I classified this patient as grade B because she's older, so the bone loss presented at a slow rate, but I consider her a moderate rate because of the hyperthyroidism medication, which affects wound healing and makes her prone to infections. This is the gingival description table for my patient. She presented with generalized bright red color of the gingiva, also generalized rolled margins with festoons, and most of the margins were receding. Also, most of the papilla were crated. For the consistency, it was generalized, soft and spongy, and the texture was shiny. Assessment statements. The patient presented with alcohol use, hyperthyroidism, and generalized stage 4 periodontitis. She is classified as generalized periodontitis stage 4, grade B, and the gingival color appears bright red. Gingival contour presents with generalized receding rolled margins with festoons and generalized cratered papilla. Gingival consistency presents as soft and spongy, and gingival surface texture is shiny. This is one of her radiographs. I like this one because it shows a little bit of everything. So as you can see on the top left corner of the picture, you can see some horizontal bone loss. Also in that area, you can see some heavy calculus deposits on the root surfaces. Uh, in the bottom of the picture, you also can see bone loss again, and in the middle part of the bottom, you can see some vertical bone loss, some 5 to 6 millimeter bone loss below the CEJ. You also can identify the class 2 furcation, and you can see that she has missing tooth due to periodontitis. Here are some pictures of her gingiva. In this one, we can identify the cratered papilla, the rolled margins, and the recession. This picture shows ulcerated lesion, which is one of the side effects of her medication. In this picture, besides the calculus deposit on the teeth, you also can see her gingiva has a soft, spongy consistency and a shiny and loss of stippling appearance. This shows the McAuliffe tombs around the CEJ and also shows the bright red coloration of the gingiva. The prognosis for this patient is poor because she already shows class 1 and 2 furcation involvement. She also has lack of motivation to take care of her mouth at home due to all the things that she's been through. If left untreated, the periodontitis can lead to tooth loss and spread of infection to other organs and tissues. For the treatment, we can do SRP and regular period maintenance, and she also needs to change her habits at home and start practicing oral hygiene at home. In the short term, the goals are to heal the gingiva by eliminating the soft and hard deposits from the root and teeth surfaces. She needs to establish oral hygiene routine at home by brushing her teeth with manual toothbrush using a bass technique twice a day, and also cleaning the proximal surfaces with a water flosser. I think that's the best because it's easier to manipulate, so that can be one less barrier for her to start cleaning her mouth. And long term, we want to stop bone loss, decrease or keep the same pocket depth, and do periodontal maintenance every 3 months. The modifiable risk factors are her oral hygiene at home, alcohol use, and the medication. She can maybe choose medication with less side effects, talking to her doctor. And the non-modifiable risk factors are age, gender, ethnicity, and the thyroid hormone disorder. These are the codes for her treatment planning. We want to do examinations. The first one will be the D0150, which is a comprehensive initial evaluation, which includes periodontal screening. In the following appointments, we want to do the D0140, which is a limited oral exam, only focus on the problem. For the treatment, we want to do the D4341, which is a SRP for 4 or more teeth per quadrant. We also want to do the D4381, which is delivery of localized antimicrobial agents such as arrestin. And we also want to work with oral hygiene instructions, which is the D1330 and the D1340, which is training in preventive oral care. Here's a flow chart with the treatment plan, whereas the darker blue is the first appointment. The column in the middle is the second appointment, and the light blue squares are the third appointment. So we want to start doing a examination consisting of review of medical history, vital signs, intro or extra oral examination, dental charting, full mouth x-rays, full mouth probing, and plaque index. After you gather all this data, we can start the treatment, which consists of administration of local anesthesia and SRP of upper right quadrant, and then applying some Arrestin as needed for the pockets. And also during this appointment, you want to explain to her the disease process for periodontitis, and give her post-therapy instructions. During the second appointment, we're just going to do a quick examination to check for an improvement of the gum tissue since the last visit, and then you're going to treat another quadrant. We're going to do the lower right quadrant this time, and we're going to give her some local anesthesia for that. And after the treatment, we can deliver some Arrestin for the lower right quadrant as needed. And at the end, you want to teach her how to use the water flosser and how to use the best technique for brushing her teeth. And also you want to keep her motivated to practice oral hygiene at home. And also we're going to give her some post-therapy instructions. For the last appointment, again, you want to check for any improvement of the gum tissue from the quadrants that worked before. At this time, because you don't have to spend so much time on examination or dental hygiene instructions, we can work on two quadrants. So we can do the left side of her mouth. For that, you're going to apply some local anesthesia, and then after the SRP, we can give her Arrestin as needed for the left side of her mouth. And at the end, you want to talk to her again to keep her motivated to practice oral hygiene at home, give her some post-therapy instructions, and explain why it's important for her to come regularly for periodontal maintenance. The instrument selection for her treatment, I chose the Gracie's 1314 after 5 rigid for distal surfaces of the posterior teeth. Also, the 1112 after 5 rigid for buccal or lingual and mesial surfaces of posterior teeth, and the 12 after 5 rigid for anterior teeth. I chose this braces because the braces in general provide minimal tissue trauma and easy access to furcation because of their curved teeth. The after fives have a longer shank, which is the ideal for deep pockets. And the rigid shank helps us to have better stability to remove heavy tenacious calculus. For the scalers, I chose the Montana Jack. Regular rigidity. This is good because it has a really thin tip that is best to remove interproximal calculus. For ultrasonic inserts, I'm gonna use the thin curved tip for the furcation areas. These are very good to reach under the furcation. And the universal tip throughout the mouth because it has a thicker tip, and it allows us to use a faster setting of the cavitron, and it's better for the heavy calculus that the patient presents. Here are some home care recommendations for this patient. Because she shows severe signs of gingivitis, we're gonna prescribe her alcohol-free chlorhexidine. This is good to um, heal her gums, and the alcohol-free because she has some alcohol use issues. For this, she's gonna rinse 2 times a day for 30 seconds after brushing her teeth. For over-the-counter dental aids, she can use biotin to treat xerostomia due to her alcohol abuse medication. For toothbrushing, she is going to use a bass technique with a soft toothbrush, and then she's going to brush her teeth twice a day for 2 minutes. For the toothpaste, I'm recommending the Sensodyne Sensitivity and Gum. This is going to help her gums to heal faster. The instructions for this is use a pea-size amount on the toothbrush before brushing her teeth. For floss aids, I'm recommending the water flosser because I believe it's easier to use, and it's is something that she can comply on doing at home. For the instructions, she needs to position the tip on a 90-degree angle pointed to the gum line. For interdental aids, I'm recommending the interdental brush to brush between the teeth where the papilla doesn't cover the teeth, where the papilla is cratered. For the fluoride, I would like to give her a mouth rinse, alcohol-free fluoride because she suffers from xerostomia. I believe that's a good aid to help prevent cavities. And then she needs to rinse for 60 seconds in the morning and also before bed. And she needs to avoid any mouth rinses with alcohol because of um, her alcohol abuse problem. This is the nutritional analysis for my patient. She has hyperthyroidism disease, and she has a condition of alcohol abuse. So iodine increases thyroid function. So basically, she should avoid food with excess iodine, such as seafood, milk and dairy, egg yolks, and cheese, and she should substitute those by low iodine foods such as egg whites, fresh fruit, oats, and she can use non-iodized salt. I found out that cruciferous vegetables may stop your thyroid from using iodine properly, so this helps with hyperthyroidism as well. These vegetables, example of these vegetables are broccoli, Brussels sprouts, kale, and cauliflower. She should completely omit alcoholic beverages from her diet or any food that contains any kind of wine or liquor. Also, because of her medications, she has xerostomia, so she should avoid carcinogenic foods to prevent cavities. And also, herbal or vitamin supplements may contain iodine, so she should be avoiding those too. For the supplements, she should be taking iron because low levels of iron are linked to hyperthyroidism. Also, selenium may help to balance thyroid hormone levels and protect your thyroid from disease. And the zinc helps you use food for energy and also keep your immune system and thyroid healthy. And also because hyperthyroidism causes weak and brittle bones, she should be having calcium and vitamin D supplements. And that's it. Thank you so much for watching my case study video. And if you have any questions, let me know.